My name is Brett from Rocktape. This is Tony, and today we're going to show you how to tape a knee. With this particular application, it can be used for arthritic changes, soft tissue injuries, cartilage injuries, and anything else that may cause an inflammation process. So we always have the body in a stretched position. So in this case, we have Tony with his knee bent at 90 degrees. When applying the tape, I want to have the tape start at the top, above the patella, above the kneecap, and come down. I like to measure it so it's just past that knobbly part of the knee, probably another 2 or 3 centimetres past the knee. I then measure that. Once I've got that measurement, I then keep it there and measure one about 5 or 6 centimetres longer to make it a longer one. I then round the corners. So you can see that there's 2 pieces of tape. Try again. 2 pieces of tape. One's about 5 or 6 centimetres longer than the other one. You also get a decompression tape. And the decompression tape goes across just so it's half on that knobbly bit of the knee, the typical tuberosity, as so. This one goes across at about 80% stretch. The first and last 3 centimetres is put on without any stretch at all. Give it a good rub, the glue's heat activated, and that will help it stick to the body a lot better. We then get the short piece of tape, and about 3 centimetres, so 3 finger lengths above the top of the kneecap, I make a little spot, I make a note where it is, and that's where I want the edge of the tape to go. I place that basically in the middle of the kneecap, with a little bit of a gap there, and it's laid on an angle, so when you lay it down, it's going down towards the ankle. I then pull it out with about 30% stretch, and I wrap it around the outside of the kneecap. Give it a good rub, make sure it's stuck firmly, and that way, there's the edge of the kneecap here. You can see that the tape is on the outside of the kneecap. I can then get the longer piece, and the reason why it's longer is we don't want to have the tape starting on the tape like that. We want it just a little bit wider and on the skin. Again, you put it on an angle so that tape is aimed down towards the ankle. That little V that you got there from the tape is then about 3 fingertips width away from the patella or the kneecap. There's no stretch placed on the first 3 centimetres. I put about 30% stretch straight down around the patella. As you get underneath it, you just wrap it around, and you can see that by being longer, it finishes on the skin. Give it a good rub. Make sure it's nice and firmly stuck to the skin, and then when you lift the kneecap up, you'll give this little wrinkling effect through there, and that's just encapsulating that patella.
More altruistic, because